Let's queer up the worldview. A new study reveals how discrimination intersects LGBTQ+ challenges for healthcare and medicine. In the United Kingdom, LGBTQ+ History Month 2024 will honor the significant contributions of LGBTQ+ individuals to the field of medicine and healthcare. This year's theme has been selected and announced as Medicine Under the Scope. It highlights achievements while spotlighting ongoing challenges in the face of rising hate crimes against the LGBTQ+ community. A survey by the British Medical Association, called BMA, and the Association of LGBTQ+ Doctors and Dentists reveals stark discrepancies in medical workplace experiences. For example, only 26% of heterosexual respondents to the survey recognize homophobia as an issue. Contrast that to 71% of LGBTQ+ respondents. It emphasizes the need for awareness and support within the medical profession itself. The British Medical Association states, quote, "Discrimination against LGBTQ+ staff not only affects their well-being, but also impacts the quality of care provided to patients. Studies by Stonewall reveal that a significant portion of LGBTQ+ individuals have witnessed or experienced discriminatory remarks from healthcare staff, leading some to avoid seeking treatment altogether. In particular, transgender patients report unequal treatment, highlighting the urgent need for inclusive healthcare practices." End quote. The Royal Society reports 20% underrepresentation of LGBTQ+ individuals in healthcare, emphasizing the importance of diversity in fostering innovation and inclusion and inclusive environments. To support LGBTQ+ individuals, the BMA advocates for comprehensive training of healthcare workplace inclusion, LGBTQ+ leadership programs, and increased visibility of LGBTQ+ role models. Implementing feedback mechanisms, addressing intersectional issues, and creating inclusive workplace policies are essential steps toward fostering a supportive environment. The BMA concluded that improving LGBTQ+ visibility in healthcare delivery dramatically improved overall healthcare for the LGBTQ+ community. By championing inclusivity, workplaces can set a precedent for equitable treatment and create environments where all individuals can thrive and contribute to advancements in medicine and healthcare. This was an amazing statement to me. This survey really brought me to a stop. Thousands of stories that we have done at Queer News Tonight, at Hotspots and happening out about healthcare in LGBT. This was something new that I hadn't considered before, because we focus on the delivery of healthcare as the individual, as the patient. What the British Medical Association was drawing attention to is that starts at the institutional level, and great healthcare must be great in the institutions that deliver healthcare. It was an all-stop moment for me that really was part of the inspiration of doing this special edition. What do we think about what they're saying about what goes on in our healthcare institutions, our hospitals, etc.?
Well, you know, Al, it's really important. You can't really emphasize enough. And it actually starts at the college level. It needs to be inclusive in the schools as we are getting our education to become those providers. And it then gets re-emphasized by the institution that you choose to work at as a medical provider, and really needs to be part of that culture. And Holy Cross has made great efforts to ensure that if it didn't happen prior to coming to Holy Cross, that it happens once you do.
Yeah, it's really important that as an institution, the leadership of the institution understands the importance of diversity and inclusion. I was a patient at Holy Cross last year, and it was so heartwarming that I was able to have my husband's name up on the board. Not my friend, not my roommate, but he was my point of contact, and he was respected as he should be as my husband. And those small steps matter. It's when we train our patient access staff who first interact with the patients when they come in, that they know how to ask the right questions, how to make sure they understand the importance of the correct pronouns, not misgendering folks, especially our trans community, which, as we know, is very much under attack in our society, especially in our state. So we at Holy Cross feel that it's our responsibility as we serve in the spirit of the gospel, right? In that spirit of inclusion, of love, that when folks come to our facility, they know that they are welcome, not just welcome, but celebrated.
I'm curious beyond, and we'll talk a lot more about the Holy Cross experience, but I'm curious broadly from the different levels of institutional healthcare that you represent in different ways. Does it surprise you that the British Medical Association is drawing attention to the fact of the great disparity that goes on in healthcare delivery? The idea that only a little less than a third of heterosexual healthcare providers, nurses, doctors, clinicians, whatever it might be, think that discrimination or inclusivity is an issue, where it's 3 times greater among community members. Did that statistic surprise you at all from your experiences in healthcare?
Well, for me, when I moved down here 6 years ago and I started working with Ryan White, my partner and I who moved here actually went to the same physician. And he, as a black man, I literally watched the difference in treatment of healthcare he received compared to how I received healthcare, because I had insurance and he did not. So I saw the disparities in that healthcare, and then working with Ryan White to enroll people living with HIV, and hearing those stories of people like going and they feel like they're not heard, they're not being treated well, only kind of exasperated, my role as an advocate, for this community. And, I feel like coming to Holy Cross, I found solace in that it's so welcoming. It's, from every point of view, there's not issue. In broad healthcare facilities that are delivering healthcare, why do you think in 2024 we don't see as much diversity in our healthcare system that we would want? Why do you think it happens?
So, as you said in the intro, I teach at FAU, so I have a pretty good window into what's happening in pretty much in all the healthcare institutions in South Florida. And I think the answer to your question lies in leadership, right? So if you have a leader or a group of leaders who understand that diversity, equity, inclusion, and belonging are important, we see that in the LGBT community, Q community. We see it also in the African American community. We know that, for example, African American women die at 3 times their infant mortality is 3 times that of white women, right? So there's a systemic racism built in. So I wasn't surprised by that statistic. But for me, it was like, wow, okay, we need to just work that much harder, not just only at Holy Cross, but throughout healthcare. And I'm teaching master's level healthcare leaders of tomorrow. And I have this conversation every single semester with my students is, how do we first call it by name, right? Give voice to those who don't have a voice. How do we talk about these issues that are difficult to talk about, right? Just in general in society, and certainly today in our state. So that's my first challenge to my students is I want you to think differently. And FAU is a very diverse school. So my African-American students, they relate right away because they've been there. And then, we'll do a little round table discussion and they'll share their personal experiences, similar to what you said about your partner. And I think, first of all, we have to call it by name. And second of all, the leaders of healthcare in this community need to invest in training, in awareness, and helping people understand the other is not really the other. We're all in it together. And I think when that happens, and you see it, there's a number of institutions in our market that have embraced diversity, equity, inclusion training specific to LGBTQ. And frankly, there are others who aren't so excited about it. And so I think that it didn't surprise me at all, to be honest.
Kim, I'm curious from your standpoint. You sit at a senior vice president level at a major hospital healthcare group here in South Florida. Do you see, representing Broward County, for example, the state HIV/AIDS organization of healthcare professionals, have you, through your career, do you see it improving, or is it staying the same, or have the days of what we've watched over the last couple of years actually worsened the situation?
It's changed. I think in general it has definitely improved, but those folks who were marginalized before are still marginalized today. And that's where the greatest efforts need to be, because they suffer the most. And it's our responsibility as healthcare providers to really reach out. And that's why outreach is so important. And it's such an important component of everything that we do. Because if we don't go to the people, how do the people know to come to us? Mm-hmm. And we need to make access easy. We need to partner. We need to understand. And if we don't, we need to learn. We need to be open to learning. But I think overall, things have improved. Drugs have improved. Regimens have improved. There is more choice. It's not a handful of pills. It could be 2 pills. It could be a shot. And so therefore, that improvement has impacted many, many lives. But if you look at who has benefited the most and who have benefited the least, there is a great disparity.
Still disparity.
Absolutely.
I'm also curious from the standpoint of where we are on how a healthcare system, and when I use the phrase healthcare system, it's focusing on a hospital, a healthcare group, et cetera, that provides and delivers services for the LGBTQ community. When you're trying to make the commitment for diversity and inclusion and the attempt to educate medical staff in understanding why it's important, et cetera, we hate to talk the politics, but I'm forced to talk the politics a moment where we see in states, including Florida, that we have demonized the word diversity and inclusion. When that happens in politics, how does that trickle from the political standpoint into healthcare delivery? What happens in diversity and inclusion when that happens?
I'll start if you don't mind. Sure. For me, I feel like it's policy, right? It's I feel every organization should have policies and procedures written that support that community, the LGBTQ plus community. At its entirety, whether it's staff related, what it is, but if those policies are in place, there's no institutionalized directive for them to make those changes. And I think it does start with policies.
Yeah. But I guess broadly, and while I understand that, I guess broadly I'm asking, and maybe there isn't an answer to this, that when we are watching a Fox News that is anti-diversity and inclusion every single day, 40 times a day, and it comes out of governors' mansions, and it comes out of some quarters or many quarters in the Capitol. How do healthcare systems fight the idea that diversity and inclusion is really important, not only to be adopted by that healthcare system, but that it should be a policy that is good for our community, our local community, our state, our nation, etc. How do we fight that?
Well, as healthcare professionals, we take an oath to care for all. And all is inclusive of all. So, what's happening at the political level and what's happening inside the hospital rooms, what's happening inside a physician office, what's happening as a relationship between nurse and parent or nurse and patient, we've taken an oath to care for you. And that oath needs to include everybody who is in that bed, who is on that exam table, who is walking through the door.
And to add to call out the elephant in the room, policy and politics have the same root word, if you will, and so it's a 4-letter word: vote.
Yeah,
vote for people whose values are aligned with yours. For example, just this week, the Biden administration issued a directive using its authority to inform hospitals and healthcare providers that they must take care of LGBTQ, specifically trans folks, in the same way without discrimination. So that's one example. You have competing interests at a state level that, unfortunately attempt to demonize the LGBTQ, especially the trans community. And we as healthcare leaders just need to double down and say, look, we took an oath. Luckily now also the regulatory environment. So we have the Joint Commission of Healthcare Organizations, which is an accrediting body which basically contracts with Medicare to let us be Medicare providers. Very simplistic. They come and they survey us. Well, they now have required us to collect SOGI data, right? And Kim can talk more to the specifics. So you're seeing that movement. But it really, as Kim said, it's at that bedside. It's when that doctor or that provider, that nurse, that social worker, that caseworker, whomever it is that's interacting with that patient and family, to remember that they are a patient, full stop. And we're not supposed to decide our own, implicit biases, which we all have, right? Mm-hmm. So it's to the extent that we can control those biases. I give my students an assignment at FAU called the Harvard Implicit Bias Test. And if you ever want to spend a few minutes, it's free. You go online and you type in, and it measures how quickly you respond to different things. You can pick, there's like 40 or 50 different categories that you choose. And I'm always fascinated I don't ask my students what they learned, what were the results, but I typically ask them, what did you choose? And it's amazing to me how many students do choose LGBTQ or race or skin tone or poverty level, right? There's even one about math, which I thought was hilarious. Mm-hmm. But I think that's really the key. The key is for us as leaders to put our foot down and say, look, we took an oath. We're here to serve. And we just must do it. There's no, to me, there's no gray area, right? It's
not up for debate.
It's not up for debate. People are sick. They need our care. End of story.
Yeah. Before we close out the conversation on this headline, move on to Vaughn. The timing of this reporting was particularly ironic to me. I was referred by my doctor to a specialist at a major hospital in the area of Fort Lauderdale, and the doctor was very pleasant, and he asked me, "What do you do?" And I said, "Oh, well, I work with Hotspots magazine and Happening Out." He had absolutely no idea what that was. I said, "I'm associated with the most popular LGBT evening news show in the country on Apple." I referenced, and I said, "It's called Queer News Tonight." And he goes, why is that here?" And he had no understanding of the LGBTQ community in Broward County. And I said, this is one of the largest LGBTQ communities in the nation. Right. And he goes, "Oh, I didn't know that." And I thought, you're in a major hospital. You probably see so many patients, and if you're not affirming to the community, how can your bedside, even in your office, be great? And it was just interesting to me, which is really the value of
very interesting
the story. Exactly.
And a huge learning opportunity.
And no questions. There was no follow-up. It was, wait, maybe perhaps I should learn something. And I'm laughing in my head going, wow, it's really interesting.
The lack of curiosity amazes me sometimes.
Yeah, that's exactly it.